Hello, welcome to Medical Dialogues. I'm Roshni and today we'll talk about an interesting case involving a painter who tragically lost both hands in a devastating accident. Sir Gangaram Hospital, the 45-year-old took a monumental step forward, his life forever changed by what marked the first successful bilateral hand transplant in New Delhi. His journey from the depths of despair following a train accident in 2020 to newfound hope and opportunity served as a testament to the resilience of the human spirit and the generosity of strangers. The hands that guided his brush were once those of Meena Mehta, a former administrative head of a South Delhi school. In a lifetime, she made the noble decision to pledge her organs, a choice that fresh life into the aspirations of this talented painter. The surgery conducted at Sir Gangaram Hospital, Delhi, not only transformed the life of the recipient but also honored the selfless legacy of Meena Mehta. To talk in detail, we have with us today Dr. Swaroop Singh Gambhir, Senior Consultant in Plastic and Cosmetic Surgery at Sir Gangaram Hospital. Welcome to Medical Dialogues, Doctor.
Thank you so much for inviting me here.
So, Doctor, can you tell the case history?
First of all, hand transplant was done first time in Delhi. Okay, it's not a very unique surgery, but it's been done first time in Delhi. In India, already been done before, and in the worldwide also has been done before many times. So it's a quite successful procedure. Okay, these procedures are only for those patients who have unfortunately got their bilateral hands amputated or single hand also amputated and not able to work with other hand. So these are for those patients. And for this patient, unfortunately, this patient had an accident in 2020. And he's a painter by profession, and he was crossing the tracks. He slipped, and there was a train coming. He got both his upper limb amputated, and they were severely crushed. We could not reimplant it, we had to leave the stump like that only. And during the course, we have tried artificial prosthesis for this patient, but patient was not able to use it properly. So the hand transplant was the only solution for him. And we have been trying to get our hand transplant accreditation being done in Gangaram for quite a few years. So in January 2023, we got accredited by the Noto Delhi, by the Delhi government to do the hand transplant. And we had this patient in our waiting list, and we were waiting for the right donor. So when the donor came in January, we called this patient and we checked for the whether we could do this patient. We checked, the cross match was done, and it was found that we could transplant this limb to this patient. So we had done that.
Right. So what were the complications you faced during the surgery?
Thing is, because it's just like any other organ transplant you're doing. Like you have heard of liver transplant, kidney transplant, very commonly being done nowadays worldwide. And the same problem we face, because this is not part of your own body, and we are getting it from the other body. So body rejection is the part. As far as technical expertise is concerned, we are all plastic surgeons, microvascular surgeons. We are trained like that, and we have been doing this microvascular surgery for quite a few years now. So as far as technology is concerned, it was not a difficult thing. But of course, physiologically managing that patient not rejecting the limb was a difficult part, which was definitely managed by our team.
Right, doctors. So what are the prognosis? Is the patient well now?
Of course, I told you before that this is not his own limb. It is being donated. They are donated limb, and it's not part of his body. So body always try to reject this limb. So he has to been on immunosuppression. The drugs that we give to suppress the immunity, that body don't reject it. It is being continuous to the patient, and he has to take for lifelong. And because his immunity is being suppressed, so he will be exposed to lot amount of infection nature. So he has to protect it from those. He has to be careful that he don't go those places which are dirty or in crowded area, and he has to wear the mask properly. Living a normal life he can use. At present it's just been 1 month, so he will not be able to use the hands right now. It will take around 8 to 9 months of time for the hand to start functioning. And once they start functioning, he can lift the thing, he can move the object, he can take bath, he can do everything. But there are certain fine movements like putting a thread into the needle. He cannot do that. But rest all the activities he can do it.
Right. Thank you so much, doctor, for your insights and for your time. Case was managed extremely well with tremendous efficiency and expertise of Dr. Swaroop Singh Gambhir and his team. Salute for giving new lease of life to patient who had lost all hope and undertaking such a high-risk surgery. And also Meena Mehta's act of organ donation exemplifies the profound impact one person can have on the lives of others. By registering as an organ donor, you can give the ultimate gift of life to those in need. Your decision to donate organs can bring hope and renewal to individuals and families facing challenging circumstances. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.